Hello, learners. Welcome to Nurse Onyi Teaches. It is an honor and privilege to share this journey with you all. I do acknowledge that pregnancy, childbirth, and the period afterwards is a very special and intimate time in people's lives, and I respect the opportunity that I am given here on this platform to join you on this journey, to share information with you, and to help you along so that you can be the best moms, dads, brothers, sisters, grandparents that you can possibly be. A little background on myself on what qualifies me to speak on the topic and how I intend to engage my audience. I am a registered nurse. I hold an advanced degree in nursing and I also have a degree in business administration. When I practiced at the clinical side, which is bedside, I dealt specifically with maternity patients. That includes laboring mothers and their support partners. I dealt with the postpartum population, which is what comes after the baby is born, where moms recover. And then I also took care of babies in the nursery. Beyond that, I am myself a mother of four children, so I have my personal stories that I can also tap into and better inform those who are listening to me here on this platform. Um, in order to help you best, I am going to keep my narratives very simple, direct, succinct, and make sure that I explain them in ways that everyone can appreciate. So, what I'm going to be doing here in this channel, Nurse Oni Teaches, is to expound upon topics that I noticed a lot of my patients did not have a lot of information about. I dealt with situations where patients would come in and they didn't know what to expect during the laboring process. They didn't know how to handle themselves or how to properly care for newborns in the postpartum period. And I had patients with a lot of hesitation and questions when it was time for them to discharge. What I am here to do is make that transition as smooth as possible, and you will achieve that if you view these videos. View them a lot if you are someone who is not well versed on the topic. I make sure that I provide enough information so that when you finish the video, you are somewhat, you probably won't be an expert, but you are better informed and ready to take on the situation that presents itself. Okay. Um, I will cover topics including labor, what to expect, the different phases of it, what will happen after the baby is born, both to mom and to baby, and how to take care of yourself in the postpartum period, how to take care of baby in the postpartum period, what tests are routinely performed in the newborn, what tests mothers can anticipate for themselves if needed. I also cover things like ways to help those who are trying to conceive. Now, I this is where I put my disclaimer. Although I am a licensed nurse, every individual varies in how much care they need and the approach to their care. Okay, so make sure that you ask your personal provider, that is your obstetrician or your nurse practitioner or your gynecologist, on what best informs your care as a patient. Do not refer to this and treat it as exclusive medical advice and say, oh, Nurse Oni said I can do it. Remember, this is for the general public. Okay, you have to tailor these things down to exactly how it fits your unique needs. So, without further ado, grab your husbands, grab your wives, bring the grandparents along. Brothers and sisters are welcome. We love the little brothers and sisters. We love the big brothers and sisters too. And everybody, come sit down, bring a notepad, and learn something new. Okay? We are here to learn. If you have any questions that you would like answered, you can go ahead and shoot them and post them in the comment section, and I will do my best to address all the questions that I get. Okay? Now, like I said, topics, nothing is really off bounds as long as it relates to the prepartum, intrapartum, and postpartum periods. Issues that also affect things like conception, things that are general knowledge. I will also discuss here. And then what happens when you get home and things to expect that to be covered here too. Okay. So thank you once more for coming. I hope to enjoy this journey with you all. I hope to grow with you all. I hope to hear back from everyone who benefits from this. Let's grow this community together. All right. Be blessed.